This study is about the long-term effects of childhood stress and trauma. We've known for quite a while that childhood stress and trauma affect an individual's health, but we don't know whether they impact that person's child's health. And so in this study, we looked at parent maltreatment in childhood and whether that is correlated with their children's behavioral health problems, including ADHD, attention deficit hyperactivity disorder, and emotional disturbance or mental health. We found that parents who had 4 or more adverse childhood experiences had children with twice the risk of ADHD, attention deficit hyperactivity disorder, and 4 times the risk of an emotional disturbance, meaning a mental health problem in childhood. One of the most interesting findings was that mothers' adverse childhood experiences were much more strongly associated with their child's behavioral health problems than were fathers. Our other finding was that parents who had been abused, neglected, or had household dysfunction when they grew up were more likely to in turn have aggravation or frustration in their parenting roles when they became parents. They were also more likely to have mental health problems. And it seems like those 2 things, the aggravation and the mental health problems, were associated specifically with their children's behavioral health problems. One thing we really want to understand is why parents who might have the same number of adverse childhood experiences have children with different behavioral health outcomes. One reason might be that those parents have different resilience factors or protective factors that counteract those ACEs and protect their children from behavioral outcomes that are worse. This study adds to the evidence supporting standardized screening for adverse childhood experiences in pediatric health visits, so as to understand which children might be at higher risk for behavioral health problems long term, and to actually do something about it sooner, such as parent coaching or offering mental health services to parents that experienced higher rates of ACEs during their childhood.